Hey, we are live from the kitchen going over viewer questions and comments. You guys can go ahead and start writing in. It takes a while for things to get going, especially since I didn't pre-announce this one. It'll take a while for people to start trailing in and finding us, getting their notifications through YouTube and Twitter and Facebook. And usually the people on Twitter and Facebook, they take quite a while to come in. So you guys go ahead and let me know where you're from. Say hi. Yes, you are first, Shower Relief. And Lita131, hello. Samantha Perez. We are in Auburn, California, Northern California, Beauty 2250. Hi, Regina, a familiar face. It is so good to see you, Regina. Thank you for coming. And Beauty 2250 from New Orleans. Lita 131 is a huge fan. Lita, good. We're going to get to know you. Shower Relief is Ohio. Visalia for Joyce Lala. Jen Grant is in Nevada. Let's see, what else do we have to say? Oh, I had a question for Regina. Regina, are you the one who asked the question about meningitis? If so, let me know. Lisa Manna is in Missouri. Let me know where in Missouri. I did medical school at SLU and spent 3 years in Kansas City for residency. Lita 131, I live in Pennsylvania. I'm 19. I love all things medical. Good, you'll like this channel. Samantha Perez is a big fan from Connecticut. Good, Samantha. Rebecca, Washington, Florida. Lee's Summit. Okay, I actually used to moonlight in the hospital there at Lee's Summit. Brittany from Memphis. Hi, like your channel. Thank you, Marcia. Terry, hi, I'm new. Welcome, Terry. We are glad to have new people join us. Oh, let's see here, Regina. You're disappearing there. No, I don't think it was. Okay, Regina, it wasn't you. Lita 131, really love the earwax. Yes, that's us. We enjoy them too. Lynn Riddell, hi, Dr. Vaughn, New Zealand. Yes, Lynn, you're from New Zealand and you have been here before and we appreciate you all the way from a faraway land in another hemisphere joining us more than once. Christy Lunsford from Texas, hello, Christy. Bianca Dye, hi again from the UK. Yes, hi again, Bianca. But Regina has a question, so let's go ahead since we have a question. Why do pimples, I'm sorry, let me get back to it here. Why do pimples itch and or hurt? It has to do with chemical mediators that are released in inflammation. Inflammation being a state of, well, pretty much just whatever causes these things to be released. It can happen from injury, it can happen from infection. A number of things can trigger this release of chemicals from cells that are in the skin, mast cells, and from certain types of white blood cells that stimulate the blood vessels to dilate and cause certain types of nerve receptors to be stimulated. That's why you can get itching and pain. But among other things that happen with inflammation, let's go Latin on you. Okay, let's do this because it rhymes and rhyming is fun. You've got dolar, rubor. Okay, maybe it doesn't totally rhyme. Dolar, rubor. I'm trying to make it rhyme. Dolar, rubor, calor, tumor. Four of these things. Tumor, you know the word tumor, that's a swelling, some kind of a mass in the body is a tumor. So just simply swelling that comes with inflammation is tumor. Dolar is pain. Calor is heat, it's hot when it's inflamed. And rubor is red. Now I think I may have switched one of those on you and I apologize if I did. But those 4 words, the N and OR, describe the 4 cardinal elements of inflammation, not to be confused with infection. Oftentimes this comes up when I'm talking about an itis. Let's see, what are some? Epicondylitis. It's not an infection. Itis means just inflammation. So a little bit of Latin there for you guys. Now, I'm going to get caught up on some comments that have been flashing by. Oh, also, Super Chat is on. If anybody wants to use it, you will get special attention, and deservedly so. But I'm going to back up and try to catch some comments that have been just screaming by. Okay, Joyce Lala is new to the channel. My specialty is family medicine. Hi from South Carolina. Hi from Ohio, from Robin. Lita, what's the grossest thing you've ever done? Lisa, I don't even want to talk about it in mixed company, but I will. It would have to be manual. It's like the only thing that makes me, almost lose it. And on occasion that will happen, thankfully, very rarely. In fact, I think I've only done as many of this procedure in our 11 years of the Actually, next month will be 12 years. 12 years with the Auburn Medical Group. Only done it, I think, in that whole 12 years as many times as I did it in just a couple years in emergency medicine or urgent care. When I say urgent care, I think of my old boss and how she almost forbid me from doing it because you'd have to open all the windows. So what we're talking about is manual fecal disimpaction when somebody has severe constipation to the point you call it obstipation, and nothing's working, and the only thing that works is to go dig it out with a double gloved finger. Okay, let me get caught up on some. Yeah, Alita, I'm so sorry to have said that. Blame it on, who was it? Was it Regina who asked? No. Who asked that? We need to know who asked that. That was awful. What did you do to us? I have to go back through lots of comments to find out who did that. No, that was not Regina. That was Lita. You're the one who asked that. Okay, getting back to where we were. Hi from Salt Lake City. Got you live. Yes. It's hard to catch me live because I don't have a committed regular time to doing this yet. I know that would be much better for getting people to participate. I do recognize that. Showerly from Columbus. Good morning, Doc, from Mandy. Catherine, hi from Owensboro, Kentucky. What's your views of medical marijuana? I believe that's what MMJ is supposed to be. I'm coming around. Like many physicians or old people, either one, not that they're the same, but I mean, I'm kind of falling into the new group there, second group. Initially against it because of everything I'd been taught through, well, growing up and in society, but also medical training to a certain extent. And that's because with marijuana being a Schedule 1 drug, and actually Schedule 1 meaning it's not even available for research, not appropriate to research, where do you get your information for it? So whatever studies happen to be done anyway, even though it's not supposed to be studied, or from outside of the country. So limited data. And with that limited data set, there was research being done, but it was only what was approved and paid for through funding from people in government who thought marijuana was bad, so they'd only approve certain types of projects. So you can see how it got a real bad rap, maybe somewhat undeservedly, as we're sort of discovering. It needs to be studied. We need to find out what its benefits are. We need to find out what its dangers and risks are, because it does have some. We've seen some studies that do show there's bad things from it. We've also had a lot that show that there are good things from it, particularly treatment of glaucoma, treatment of certain pediatric seizures. Bad things, we know that if people use it before a certain age, that there's a potential for it to actually cause people to be dependent on it or addicted to it. That can happen. There's some issues with motivation in doing things that people observe with it, and these are mostly observations rather than something you can really quantify on a study. It does look like if it started, after age 21, 23, 24, or somewhere like that, that it's probably much less harmful. As far as smoking it, much less harmful to the lungs than we had thought. We used to think it was more harmful than tobacco smoke with all those chemicals the tobacco industry puts in, and that may not be the case. We're getting some data on it. Okay, let's get caught up with some comments here. I don't think anybody's used Super Chat. Hey, if anybody does use Super Chat and I miss it, everybody else please direct me to it. I do not want to miss that. So backing up a bit, I'm not quite sure how far we have to go. Brittany Sanders, how do you get earwax balls out of daughter's ear? Not going to jump into that because I don't like people doing a whole lot of instrumentation to ears at home without knowing that they have an intact eardrum. Because if you get water in there, you can actually wash in bacteria and cause a bad middle ear infection. So rather than avoid the liability of telling people to go and do even irrigations, which are the most gentle things, you can always use over-the-counter earwax remover and follow the directions with those. Those are usually fairly safe, but still, I don't know the eardrum. I don't know the situation, and with my license, I can't practice medicine on somebody I haven't examined. I am liable for all those things that probably aren't there, but I have to, because of protecting my license, not give commitment and say a whole lot of definites on things. And I can't practice medicine over YouTube Live. Lindsay, what'd you say? Hey there, just tuned in. And why does Lindsay get such special attention? Lindsay, why do I give you and Boo Boo Kitty such special attention? There's a reason. Okay, back up here before Lindsay came on, and Regina saying wow and no, and Leela. Okay, I'm sorry that my tripod's a little unsteady. It's a tiny, tiny little thing just for. Hey, Peggy from Sacramento. So good to have somebody somewhat nearby. I was very, I don't know, do you consider American River University in Sacramento? We were just at American River College, not quite university. We were just at ARC watching the play last night, directed by somebody I went to high school with, Jason Sinclair Long. Okay, Katie Harris, I'm sorry. Hi, I love your earwax removal videos. Yes, we enjoy those too. And cyst excision videos. Trying to decide between being a dermatologist or an ENT. Do you enjoy wax removal or pimple popping more? Pimple popping does not, there's actually no insurance that pays you to, that I know of, to do those pimples. We do those without charge for the patients because they're so popular on the channel that it makes up for it. ENT or dermatology? Well, I think you need to consider some other things depending on what it is you want to do. If you want to do plastic surgery would also be considered because dermatology and ENT both do that on the face. Also, oral maxillofacial surgery should be considered. For example, if you're not able to get into medical school, but you can get into dental school. When I was at UMKC in Kansas City, their dental school would have many of its graduates immediately turn around and get into the oral maxillofacial surgery residency at Truman Medical Center, which I hesitate to even call it across the street. Well, I'm sorry, it is separate from the, is it separate from the medical school? No, it's connected to the medical school. Okay, so anyway, you got these dental students, the dental school is across the street, that's why I say that. They'd graduate from the dental school and get into the oral maxillofacial surgery residency, and then in the first 2 years, they do some clinical rotations with medical students. And so 2 years into this residency, after they finish dental school, they get medical doctor degree. Then they do the residency that somebody would do if they were already a medical doctor at that point. So they're coming out of this program kind of going a backdoor approach to getting a medical degree, and then they finish up their residency in oral maxillofacial surgery, and they are doing all of the plastics procedures that the plastic surgeons are doing, that the ENTs are doing, that the dermatologists are doing, without having to ever have gotten accepted to medical school, because they did it this roundabout way. And the reason that they do this, why do they add these 2 years onto their residency by choice, even though they could finish the OMFS residency without that? The reason they do it is because then they're both a DDS and an MD, and they're able to get privileges in about any hospital they want because of that MD. Many dentists aren't able to do the big surgical procedures, plastics procedures, in a lot of community hospitals because they're kind of a closed shop and they'll only let medical doctors get privileges and work in their operating rooms. Well, now they can because they got their medical degree. So something else to look into. If you're able to get in medical school, that's not so much an issue, but OMFS is a residency that even could be considered if you graduate from medical school. So, getting caught up on your comments and questions while I was talking about ENT versus dermatology. Pamela from Atlanta, good morning. And Regina, I hate marijuana so much. I hate the smell. Regina, I'm with you on that one. If this just happened last week, we were watching Ethan race up at North Star, and they had this gondola that we were able to ride up to where they were doing the race. And in one of the cars as we rode down, it smelled like marijuana smoke. I hated it. I thought that was so rude. So I'm with you, Regina, on that one. All right, get back caught up with some other comments here. And if anybody wants me to go straight to their comment, just use the little super chat. That's the little $sign when you put in your comment or question, and we will give you priority. All right, how far back? Oh, here, neti pots. Let's jump on that. So, some Princess 882 says, do you feel like neti pots or other sinus rinses are safe for cleaning the sinuses? For the most part, yes. Be sure to use distilled water. Why is that? Well, Larry and I, some of you guys know Larry who have listened to the Medically Speaking Radio podcast found at medicallyspeakingradio.com. Larry and I did a show where we talked about the brain-eating amoeba. And the brain-eating amoeba lives in fresh water. So if you just do tap water into your neti pot, you can actually get that amoeba that can be a problem. Very rare. In fact, so rare I probably shouldn't be talking about it, but just use distilled water and it won't be an issue. Okay, back to the search for your comments and questions. All right, going back to Shower Leaf. I don't know how to pronounce it, but that's how I pronounce it. Has a question. I have friends who are general practitioners. Do you think that med school stunts social development? Oh, good question. I mean, just look at me. These guys are weirdos, but you seem normal. Ha! Okay, no contradiction there. We're trying to understand. How do I say this? Okay, to get into medical school requires a lot. It takes a lot out of a person. How do I know this? Because I've been on both sides. I was a broadcasting major for my first year of college, and then I switched majors when I became pre-med. And then I was a biology major and taking chemistry and organic chemistry and physics or calculus to get into physics. So very much science. Before that, I actually had worked it out so I didn't have to take any science once I got to a four-year college, because I got taken care of through not truly AP type classes, but kind of that channel of getting some credits because of what I'd done in high school. So I was able to play with my friends, my roommate and his brother, and all of our friends in our suite in our dorm. We had a blast. Even though my roommate, who was the same major as myself, would stay up all night sometimes during exam week. I couldn't understand this. Well, then I became a science major, and I never did all-nighters. I just never did. And thankfully, I didn't have to. In fact, I don't recommend it even to people who may feel they have to, because it's counterproductive to stay up all night studying rather than getting a good night's sleep for the test. You need to do that studying earlier somehow, program it out. So I saw that people in other majors are able to get the equivalent grade with a lot more free time. Well, this commitment that it takes to get the grades you need to be able to get into medical school, and then once you're in medical school, the commitment it takes, you are very limited socially. Plus, there's a whole thing about personality. There may be a little different personality for someone who is able to spend that much time studying, or maybe their brains are wired a little differently, that they don't commonly relate well socially. Their brains work really well for some things. You see this with people on the autism spectrum, where sometimes people can be brilliant at certain areas, mathematics for example, but just really impaired with being able to look a person in the eye and communicate and respond to jokes, all this sort of thing. So your observation may be accurate. Is it medical school that stunts their growth, or is it anybody who's that committed and focused on something and is wired that way that maybe they just don't have the gifting and the social graces as much? But I do often, I guess I can say it here, this isn't a huge medical audience. I do often feel that there is a bit of a personality deficit in many doctors, and it does seem that the specialties that require more training are more apt to have this. But then I think about people I know in the area. I think of surgeons even that I know who have been through years and years of training. They're great guys. Of course, we're kind of unique in our community here in Auburn, Sutter Auburn Faith Hospital. We have really cool surgeons, and that's not usual. And I don't mind if they hear me say this. I say it to lots of people, so I'm sure it's going to get back to them someday. I completely mean this as a compliment to our local surgeons here in town, but I bet it probably makes them feel a little weird that I'm kind of attacking their specialty or their profession. And it's just the experience I've had, and it has been that a lot of the people who are really specialized and spend a lot of years in their training haven't been nice to me personally in my training. When I think back to medical school and I think back to residency, there were some very unkind things going on between the specialties that had more years of training and those of us that did 3-year programs like emergency medicine or family medicine. So yeah, there's, you know, it's not just medicine, every profession, there's, you know, kind of a personality that oftentimes goes with that profession. You know, I was talking about surgeons earlier. You see the same personality, but in a different profession. In the film industry, directors are very much the same person as a surgeon. If you know them personally, if you know both film directors and surgeons in the operating room, it's a similar situation. There is one person who is in charge of making things work, and all the responsibility for the outcome is on them. If somebody else messes up, if a gaffer messes up setting up the lights on the film set, if a scrub nurse drops an instrument on the floor or causes something to get contaminated in the OR, that falls on the director, that falls on the surgeon. It's their responsibility what the outcome is for the patient. Even though they didn't do it, it's totally their responsibility. And so in that setting, you get this, you know, this person working up here at this level and everybody else working to support what they're doing with their hands or their directions. And there's a hierarchy there. And here's a common example. For example, if a director tells a joke on set, if a surgeon tells a joke in the OR, everybody laughs. It's the funniest joke I've ever heard. Ha ha. That's universal. I've seen that in both settings. You probably wonder, who am I that I've been both on movie sets and in the OR? We'll get to that some other time. Watch The Californians 2004 with Noah Wyle and Mark Vaughn. So going back to some of your questions that I've been missing because I've been talking so much about personalities. And by the way, I apologize if I've missed a super chat. I really don't think so. I think I would see those. Lindsay Antoine just tuned in. Why does my hip pop when I move sometimes? Because you love us. Obviously, we're pretty fantastic. Oh, Lindsay, you're answering my question from earlier about why am I so good to Lindsay and Boo Boo Kitty. Well, yes, we loved you guys even before we had Patreon, but they're patrons on Patreon. That's where that comes from. Patreon.com/Auburn Medical Group. How do I get wax ball? Okay, we talked about that. Want to be a doctor when I grow up? What's more beneficial, graduating early or trying to take as many biology-related extra credits as possible? Oh, I don't know that I necessarily have an opinion on that. I was the get through it as fast as you can kind of guy. In fact, after changing majors after my first year of college, I was still able to graduate in 3 years and start the next fall in medical school. So I was of the get it done as quick as you can plan, which I'm very thankful for now that, you know, the practice is maturing and getting to a really nice place where I can back off a little bit, do some videos, and things work, and we're able to pay the bills. But hey, if you want to take some time off, there's things in life you want to experience without stunting your growth of your personality, as somebody talked about earlier, then I'd say take some time off. Sarah Williams says, keep being you. We watch you because we like you. Lots of MDs, DMDs, PhDs are dry, but it is personalities like yours that keep us non-medical folk intrigued and thirsty for knowledge. You know, Sarah, that's probably one of the nicest things I could hear. That is very encouraging to me, especially as I'm looking at the YouTube channel and going, boy, am I just another pimple popper earwax cleaner, or will people come watch videos because of other things that we might talk about that I feel are important but aren't as visually stimulating? Of course, we'll never have viral videos on a discussion of healthcare policy. I'm not that good at it anyways. Just go to Healthcare Triage for that. But thank you for saying that. That's very kind. It's Regina. See you, Regina. We'll get together another time. No problem. Joyce Lala, I know a resident who had her bachelor's in English Lit. She's very well-rounded. Interesting you point that out. When I was going to medical school, that was the big thing that they were talking about. We want well-rounded patients. We want history majors. We want art majors. And then what ends up happening? The most popular major is biochemistry. Second most popular major, biology. Third most popular major, chemistry. Even when they're trying to make this push to get these well-rounded classes coming in, they still are picking the science majors. I don't know if it's a matter of who's applying or who they're selecting based on their strength as an applicant. But yeah, we are trying to get get more well-rounded as a profession and bring in the, the lit majors and such. Petra, cool name. It's the same thing between nurses and nurses. We that are assistant nurses isn't worth anything in some nurses and doctors' eyes, but we mostly do the work. You're exactly right. It's not just medical profession. You see in other professions too. Brent's a name I recognize because you made some really thoughtful comments. And Dr. Terry Bowles noticed your comments too. Looks like I caught the perfect time to refresh my YouTube feed. Yes, you did, Brent. Thanks for coming. Doctor, could you please go back to my question after the neti pot? I really would like the answer. Could not find it on the net. I'm sorry. I remember talking about neti pot, but Karen, so if I look for a K, if I back up through the feed, 937, please go back to my 935 question. There's a $sign, but I don't think that you actually gave to, what's it called? Super chat. Excuse me, guys, while I turn off chat for a moment to see if she actually did a super chat. No, you didn't do a super chat. Okay. But I'm going back and looking. But if anybody wants to do a super chat, you're welcome to. Okay, here we go. Oh, please go back to my 935. 935? Was that like 10 minutes ago? Maybe if you repeat the question. I'm sorry to ask you to do that. It's probably hard to type the whole thing on that little keyboard unless you're at a computer. From Madison, Wisconsin, you said something about meningitis when I signed in. Had bacterial and want to know, can I get it again? Absolutely, you can get bacterial meningitis again. Meningitis is not caused by a single organism. It's caused by many organisms. That's why the meningitis vaccines that come out, there's different numbers of organisms that they work against. That's why we recommend getting the one that covers the more organisms, the newer one of them. And yeah, you can get it again. From Sweden, yes, you're welcome, Petra. E58 AM here, just woke up here. I don't even know what E58 would be. That sounds like or maybe it's 3:58, a really early time. Fawn, is it true that smoking one joint of weed is worse than smoking than 110 cigarettes? That's what we were all taught, wasn't it, when we were growing up? I do not know of any actual real medical data to support that statement, and in fact there is quite the contrary evidence that maybe it's safer, that the marijuana is the safer of the two. Joyce, question, what's the difference between an SSRI and SNRI? One has an S, the other has an N. Does Cymbalta work well for pain? So Cymbalta is an SNRI. That N stands for norepinephrine. So in addition to working on serotonin, it also works on norepinephrine. You'll notice that it's not actually the same S that is the N. So SS, selective serotonin, SN, serotonin and norepinephrine. Selective serotonin meaning just serotonin, no norepinephrine. The other one meaning both epinephrine and serotonin. So they work a little differently from each other. The SNRI is a little more stimulating and seems to work better for pain relief, particularly in people with chronic pain. What else can I say about that? Well, that's all that comes to my head immediately. Brent, here's one for you. I know you have a practice-wide policy to not practice opioid analgesics because of the stigma and abuse. No, you're kind of mixing what we actually do and saying some other things there, but we'll go over it. An abuse that comes from it besides the GABAs, can you think of other possibles besides the GABAs? The GABAs, G-A-B-A. GABAs. Are you talking like pregabalin and gabapentin when you say GABAs? Okay, yeah, don't call them GABAs because GABA is an actual, relates to things more than just those medicines. GABA is a neurotransmitter. Gamma-aminobutyral, I can't come up with it right off the top of my head, but GABA is a chemical neurotransmitter. But yeah, those medicines work well for nerve pain. Great for nerve pain. You don't use them for every type of pain. You use opiates for other types of pains, not for nerve pain, not for fibromyalgia. Do not use them for that. People will not care so much about the pain while they have those in place, but the pain is still there. So better to treat those type pains with gabapentin and the pregabalin, also called Lyrica. And as far as us not prescribing opiates, it's not that we don't prescribe opiates, it's that we have no interest at all in taking on a patient who's addicted to opiates from another provider and then being responsible for them going through withdrawal because we continued someone else's prescription, and then we don't even prescribe the Norco or the hydrocodone containing pain medicines at all. And the reason is so that we can just simply say when somebody calls in wanting us to refill their Vicodin or Norco, we don't prescribe that, and they can move on to the next doctor. And it just keeps it a very nice environment in our practice to work with other medicines when that's the most abused medicine in our community. Brent, okay, that's where I was confused. I heard something different during the tramadol speech, and is where I got tripped up. And then tramadol, of course, works very well for pain medicine. It's a problem too, but it doesn't seem to be as bad as most of the opiates for most patients. Of course, I got a lot of comments when I talked about that. Lots of comments. If you guys look at that video about the tramadol, which, by the way, got its monetization taken away because I used a brand name of a drug in it, and that's not advertiser friendly. But we left it up for you guys. Oh, look who's here.
Hi.
Lisa, your favorite. And Leanne.
I forgot bags.
You forgot bags. So you're carrying all the groceries in your hands.
Girl Scout cookie cereal.
Boy, that's just what the world needed to see in the doctor's kitchen. Thanks, Lisa. Thanks a lot. All right, back to your comments before. Oh yeah, we were talking about Brent's question with the other possible other medicine. Oh yeah, we were talking about SNRIs earlier, the Cymbalta and the Effexor. Those are medicines that, and even older antidepressants like the tricyclics, including amitriptyline, nortriptyline, protriptyline. These are medicines that help well with people not having as bad of a problem with pain medicine. That you use them with pain medicines, they actually use less dosing of the pain medicines. So we think they don't hurt as bad. But as far as this whole chronic pain thing, there's a couple of things that are terribly underdone for patients. One of them is physical therapy. Another one is counseling. There's a huge psychological side, and that's why also another reason that antidepressants help in the setting of chronic pain is the psychological aspect to it, both from you get depressed when you hurt all the time, but also severe depression can be sensed by the body as pain. And sometimes you can't tell whether it's physical pain or it's depression pain. And treating that with opiates just leads to addiction. Lindsay, no shame. I've been passing the Girl Scout cereal pie for weeks now. I want it so bad, but I'm sticking with the whole wheat, whole grain stuff. Lindsay is a great...
Where's the box?
Don't read it. Don't. Oh, whole grain.
Yeah.
Lindsay, forget that part. Don't listen to these people back here. Keep eating the good stuff. Debbie Ronker, doctor, what do you think of patient DNR but family don't agree? Honor the patient's wishes. Honors the patient's wishes. At the same time, it's the family that's going to sue you. So, there you have it. Karen Vincent, thanks, doctor. This is my first time chatting and did it wrong. Tell your patient, Mary, I love watching her. Such a nice lady. Mary. Who's I'm so embarrassed. Who's Mary? Mary. Oh my goodness, I'm so embarrassed. I can't come up with who Mary is. Somebody called Gwen Vaughn says, I have up Girl Scout cookie breakfast for Lent. I think he means gave up Girl Scout cookies for Lent.
Good for him.
If only we could all... Dr. Gwen, were you here for the discussion about how doctors have no personality? I don't know why you made me think of that. Billy Goat 126, who has the awesome avatar there. Glad I could catch this live stream. Yes, Billy Goat, we're always glad to have you, just because I like seeing that picture. How do you have, this is from Sun Princess 882, how do you handle patients that have significantly differing opinions than you in regard to medical treatments? Like a patient who is adamant about using pseudoscientific treatment. Well, the doctor-patient relationship needs to be an alliance, and you guys need to be on the same page. There needs to be give and take on both sides. I was thinking this in my head just last week with a patient, and we were able to, I had to think while I was sitting there, because I had my answer to what they were saying and what I wanted to do for them, what I thought the problem was, and I had to let them talk and let them, say their whole thing. And in my mind, I was thinking, I need to be listening. I need to listen. And in the end, we together came up with a plan. Now, this was not someone who has vastly different or contradictory thoughts to mine in medical care. People who do, if we're not developing a therapeutic alliance where we're on the same page, I really don't want to be in that situation. I would rather they find a different doctor who speaks their language or it clicks with them better, and they're out there. Not all doctors think like me. I think that's best. I think everybody should be on the same page. I don't think that they should be working against each other. If you prescribe something and the patient never even fills the prescription, why are they coming? Why are they paying to see you? At the same time, if I'm not on board with the patient and what they're doing and think that it's actually harmful rather than helpful, then I'm not really able to help in that situation. I should not be quick to jump to that conclusion. I should really, really try to listen, to compromise, and to give and work together to develop an alliance where we both have the same goal, which is usually the case. We usually can start from that common thing. We want to get rid of X problem. It's just the way that we go about getting rid of it that we might disagree. And so sometimes we'll come up with, as long as it's not dangerous, it's not urgent that we get them some kind of care, maybe say, okay, try, going to the voodoo witch doctor for a period of a few weeks, and we'll track it and we'll see if it gets better. And if it does, let's continue with that. That sort of thing where I don't just outright dismiss their beliefs and their values because that would be wrong. But we do need to be on the same page. It doesn't mean to be shared. My license is not just something that's for rent for anybody to come over and walk over me and use and say, this is what I want done. That's not how it works either, because I have to feel that I'm being ethical and right in my practice of medicine and that I am doing what's in the best interest for the patient. So I hope that answered your question. Backing up to Brent, buprenorphine. Can you tell I don't use that drug? I'm a buprenorphine patient, so I understand the absolute necessity for more mental health access. Yes, I agree. And then Karen, right above that, she has gray hair and you did a procedure to her face. Karen. Oh, no, I'm sorry, I was thinking of Karen. You said Mary, though.
Yeah.
Mary? Mary? Leanne?
Karen.
Yeah, Karen was who I think of. Are you thinking of Karen? Okay, Billy Goat 126. Thoughts on lorazepam? Had a doctor tell me it's a terrible drug. Curious about your opinion. I think it's a terrible drug. Super Princess 882. Thanks. That was a very thoughtful answer. I appreciate the option and perspective. Karen. Sorry, your name is Karen. Yes, Karen. Karen's wonderful. Karen, you can find behind this, not really behind the scenes, but unpublished videos by being a subscriber at the $3 level on our Patreon, because that's where I put those extra videos that don't make it on the main YouTube channel, and you can see lots of Karen there. Buprenorphine, Bruponex, or Suboxone, similar to methadone without the full agonist high. Yes, because it's a partial antagonist, I guess. Lynn Riddle, net kept lagging, so not sure if my methotrexate question was answered, but enjoy listening to your question. Okay, methotrexate, we'll have to touch on that in a moment. Cha72, I was just accepted into medical school at UNC, I believe. You're talking about North Carolina there, just a week ago. Congratulations. I've been interested in family medicine and loved watching your videos. Thank you for everything. And tell all of your classmates at UNC about our videos. So, and congratulations again. Some Princess 882, do you find that there are specific types of patients that tend to allow you to film procedures? What do you think their motivations are? Yes, absolutely. In fact, I have a really high success rate at getting patients to agree to do it, over 50%, which I think is amazing considering that this is their private health care that's being put on film. And I attribute the high success rate at patients going along with it to my very careful selection of who I ask in the first place. And if you guys watch the videos, you'll see, it's not 100%. But usually when the camera is turned on, the personality shines and it really comes out in these, like Karen, she's a great example. Wonderful, gracious personalities, and truly they do act differently on camera than when the camera is not on. They turn up the charm. They really do, and it's fun. It's fun for them. It's fun for me. Again, a lot of patients I don't even approach it with. Yeah. So as far as their motivation, many of them it's out of and they'll actually say this, that they want to contribute, they want to let people know for their information. I'll tell you quite honestly, they're probably imagining more the people who are watching that truly have an interest in a particular procedure or medical problem because it affects them or their family personally, and so they're thinking in terms of that, not thinking so much in terms of anybody on YouTube can get a hold of this and watch it. And that's probably true for the procedures like the blackheads and the ear cleaning. Not so much people who have a personal issue going on with that, but just get some kind of satisfaction out of seeing the procedure done. And I guess there's some value in that too, although I really find the most satisfaction in when people are getting questions answered about the health of themselves or their loved ones. A new Damaris Cruz, I have not seen you before. Lorazepam is a great drug for neonates. It may be terrible in your practice, however, it's useful in ICU. Oh, you know, I say terrible, it's such a generalization. I apologize for that. It does have a place. It has many places, and I even prescribe. Did I prescribe it this week? No, I didn't prescribe it this week. It's not that I never ever use it. I just don't like seeing people addicted to these things. Okay, Lindsay. Took methotrexate as a teen for my atopic dermatitis. Had to have liver testing done every month. Yes, because methotrexate, which you take weekly, which reminds me of an interesting story. Methotrexate, to calm down the immune system, it can be very hard on the body. You have to check liver function tests frequently. But, you know, sometimes it's better than not taking it and having the disease. Lindsay, you commented back, it's also used to induce abortions. It can, yeah. It's used in the setting of when you find a tubal pregnancy where your choices are use methotrexate while it's small, before there's a chance of rupturing and the patient bleeding to death, or surgical treatment if you wait longer. Dr. Gwain chimes in with methotrexate. When you reach a certain level, you need a liver biopsy. Yes, and Dr. Gwain, as far as methotrexate in the setting of tubal pregnancies, I don't know how much experience you had with that because you weren't in the emergency department as much, but that, you know, there's your choice. Either let it grow and have to be operated on, or with more risk of, and you're still going to, it's essentially an abortion that's going to occur because it can't survive. Robin Mock, and take the high dose folic acid with yes, definitely take your folic acid with methotrexate because you otherwise won't be getting the benefit of your folic acid. Look at my question higher up before Damaris Cruz. Sure, Petra, I will. Let's go up before Damaris Cruz. I have lupus and psoriasis arthritis. Oh, I'm sorry. And a question, what's your thought about change OxyContin and oxycodone to Lyrica? I've tried tramadol and went sick. Oh yeah, absolutely, if the Lyrica works. Lyrica does not have these problems that the tramadol has because it's not acting on opiate receptors. It's actually an anti-seizure drug that does not make people have euphoria. You can still have withdrawal, but not as bad. Lynn Riddle, my methotrexate treatment is more to do with the hair loss that can be a side effect. Oh, I'm sorry. How long does the hair take to grow back? I don't know that it tends to grow back when that's the effect it has on a person. If you stop, Drew Jenkins is going to, let's see, what do? We just simply report and message reported. Okay, so he may have a strike on his YouTube channel. Billy Goat 126, did you always know you wanted to be a doctor? Off and on, yeah, even from being a small child. There were times, you know, my dad was a nurse, so he had a stethoscope, and I loved playing with that. I loved watching Emergency on television and seeing the medical procedures. Brent wasn't aware that methotrexate was termination of pregnancy medication. I can barely remember the days of using RU-486, I believe mifepristone, before Plan B became an option. Interesting. Yes, and Plan B really is just simply a high dose of oral contraceptive. You know, it's like taking, and Dr. Gwain and I, we talked about this a couple of weeks back, actually further back than that, whether it was 2 or 3 pills. Dr. Gwain, you all are watching my reason for becoming a doctor.
Oh. Yeah.
What?
You are the reason.
Oh, I was thinking of all these questions.
Oh.
He's flattering me. All right, Petra, I have Metrojet Needles once a week. And Lindsay, Dr. Gwain's so sweet. He's being very kind. All right, so with that 45-minute long time together, what we'll do is wrap this up. We'll do it again sometime. If you guys would, now, actually not all of you will be able to see this because it's only available to the patrons at the $3 a month level or higher. What can they do? Well, you can send messages to me on Twitter at Dr. Vaughn, or yeah, that's about the best way. If you have a particular time that you think these kinds of live YouTubes would work out well, so at Dr. Vaughn, and those of you who are on the Patreon, you can put your comments on the video there. So I'll be seeing you guys until next time. Dr. Mark Vaughn and Dr. Gwain Vaughn and Lindsay Antwine and Karen Vincent. No, I gotta go. Sorry. We'll do it another time though. Good night. See you later. Brent, yes, it was a pleasure. Stay in good health.